If the placebo effect works by tricking the brain, why does it need to be tricked? The placebo effect is a complex phenomenon that involves various psychological and physiological mechanisms. While it may appear that tricking the brain is necessary for the placebo effect to work, it is not as simple as solely relying on the brain's ability to resolve issues on its own. Here are some key points to consider. 1. Expectations and conditioning. Placebos work, in part, by capitalizing on the power of expectations. When people believe they are receiving an effective treatment, their expectations and beliefs can influence their subjective experiences and perceived outcomes. Positive expectations can trigger a cascade of neurochemical and physiological responses in the body, which may contribute to symptom relief or improvement. 2. Contextual factors. Placebos are typically administered within a context of care, attention, and authority. The rituals and symbols associated with medical treatments can influence the patient's perception and suggest that an intervention is legitimate and effective. This context enhances the placebo response by harnessing the patient's psychological and social responses to the treatment. 3. Mind-body interactions. The mind and body are intricately connected, and psychological factors can influence physiological processes. The placebo effect demonstrates the bidirectional relationship between mental and physical health. Psychological factors such as stress, anxiety, and mood can impact the body's physiological responses, including pain perception and immune system functioning. 4. Symptom relief versus addressing underlying issues. The placebo effect is more likely to provide temporary symptom relief or subjective improvements rather than addressing the underlying cause of a medical condition. It can reduce pain perception, alleviate anxiety, or improve mood, but it doesn't necessarily treat the root cause of the problem. Treating underlying medical issues usually requires specific interventions targeted at the cause. 5. Limitations and ethical considerations. Placebos are primarily used in clinical trials for evaluating the effectiveness of new treatments. While they can be effective for certain conditions, it is important to consider ethical considerations when using placebos in medical practice. It is generally considered unethical to deceive patients by intentionally providing ineffective treatments, and informed consent is a crucial aspect of medical care. In summary, the placebo effect is a complex interplay of psychological, contextual, and physiological factors. While the brain's innate abilities play a role in healing and symptom improvement, the placebo effect capitalizes on expectations, context, and mind-body interactions to enhance those processes. However, it is important to note that the placebo effect is not a panacea and does not address the underlying causes of medical conditions.